In Chapter 4 of Lyme, the first epidemic of climate change, what did you mean by a disease minimized?
Lyme disease has long been framed in two ways: that it's easy to diagnose and relatively easy to treat. And those two concepts are readily challenged. And yet, in medical school, when doctors are trained, they are basically given that message. Trust the test for Lyme disease and trust the short courses of antibiotics that we prescribe. First, the test. The test for Lyme disease is a two-part test. Our blood is drawn, and we look first for the antibody load that you're carrying. And if you have enough antibodies to indicate that you've been exposed to something, then you get to the second part of the test, in which they look for markers of specific antibodies that will be produced, may be produced, when you've been exposed to the Lyme disease bug. But the test falls down at many stages of the illness. In the first 4 weeks or so, 4 to 6 weeks, about 50% of people who have Lyme disease will be told that they're negative for Lyme disease. The test gets better as the disease progresses, but there's a basic flaw to that, in that you have to get sicker. You have to allow that Lyme disease spirochete to disseminate throughout your body in order to produce these antibodies that may or may not show that you have Lyme disease. We really do not want to let this organism fester, to let it move throughout the body any longer than it should. And there have been tests that show that the studies that show that the test works better further on. There have also been studies of these studies, and that have shown, in one case, a group of European researchers looked at 78 studies for Lyme disease tests. And they found that in each and every one of them, there was what they call a high risk of bias. In other words, we really couldn't trust the tests. And that was their conclusion after looking at all these 78 studies. We cannot say if a doctor should use this and rely on it in clinical practice. Paraphrased, that's what they concluded. So the test doesn't work. We can't tell if people have Lyme disease. They get sicker and sicker. And, the test has been defended based on those studies I told you about that say it gets better overall, but also on the concept that, you have the rash. You'll get the rash, and then we can treat you for Lyme disease. And it's long been called the bullseye rash, which is the worst name ever for a rash, because in perhaps 9 or 10% of cases, it has that clear center with the red ring outside. The rest of the time, it might be mottled. It might have irregular edges. It might be solid red. You might have many Lyme such rashes. So it really can't be relied on, especially since we've called it the bullseye rash, to be diagnostic. So that's one of the main problems. Then we get to treatment for Lyme disease. And we have been told, doctors have been told for many years, for a couple of decades, to treat Lyme disease with short courses of antibiotics, basically 10 to 28 days. And the conclusions that the people who have written the Lyme disease guidelines have made is that in almost every case, that Lyme disease spirochete will be obliterated from your body. Not so fast. And yet, in 10 to 20% of cases, these same researchers who have advised doctors to do this, short courses only, and don't repeat them, acknowledge that 10 to 20% of people who are treated for Lyme disease will stay sick for some period of time afterward, months and sometimes years afterward. One study found 5% of people still symptomatic 15 years on average later. Okay, so that adds up to, if we're going to look at maybe 2017 statistics when there were some 400,000 Lyme disease cases, that's 40 to 80,000 people a year who have what we call, very nebulously and vaguely, post-treatment Lyme disease syndrome. Okay, you have something. We know you have something, and it might be quite uncomfortable. It might be even disabling. It's been compared to or likened to congestive heart failure in some cases. But it's not from Lyme disease, is what the mantra goes. You have something else. You've developed maybe some sort of autoimmune response to the remaining kind of detritus of the spirochete that was inside you. You have inflammation that was a result of your initial infection. But because we have insisted, because mainstream medicine has insisted that the infection has been killed in you, it more or less has washed its hands of dealing with these people who remain sick, this 10 to 20% of people. And what's happened with Lyme disease is Lyme disease has become a controversy, far more than an illness that people have. It's a controversy. It's a political issue. And the whole political controversy centers around whether you are still infected with that Lyme disease pathogen. One side says no. The other side says maybe. There's some good science to show that that's possible. But because there is this disagreement, and because the mainstream side that says that spirochete is dead, has the power, has the influence, has the connections with the New England Journal of Medicine, with the U.S. Centers for Disease Control, with the National Institutes of Health, with major medical journals, that is the prevailing dogma. And that dogma minimizes Lyme disease. We have to do a lot more work to find out how to treat Lyme disease. We're not treating it well enough. We're not treating it early enough. So that is why I say this is a disease that has been minimized terribly for a very long time and at great cost to many people.